Hello, everyone. Welcome to the Addiction Alliance podcast. My name is John Martin. I'm the Director of Education for the Addiction Alliance of Georgia. I'm a licensed clinical social worker and a master addiction counselor. We're very excited about rolling out this podcast. The idea was to hopefully create a platform for people to learn more about addiction and the various topics that may come up throughout the course of the show. We're very hopeful that you enjoy and that this message can spread and that we can ultimately reach more people who are suffering from substance use disorders whom are not getting treatment, especially young people. First of all, I just want to introduce myself and tell you a little bit about the Addiction Alliance of Georgia. So we are first and foremost, we provide clinical treatment for people with substance use disorders. We have a PHP IOP program. So PHP stands for Partial Hospitalization Programming. This is a group-driven model. So patients attend our clinic for 20 hours of group a week, generally from 8:30 to 12:30, where they will experience a wide range of services from process groups to skills groups, education groups, learning about different strategies that they can use to combat cravings and to manage stressors more effectively, as well as having a space where they can share and connect with others in a way that hopefully reduces their sense of shame and isolation, which can be huge drivers of addiction. The IOP program stands for Intensive Outpatient Programming, and this is 9 hours a week. So they come to the clinic on Monday, Tuesday, and Thursday. And outside of the PHP IOP group services, individuals will typically see one of our licensed therapists for individual psychotherapy, as well as one of our addiction psychiatrists to manage any kind of medical issues, psychiatric issues, medications, etc. In addition to that, they will see a nurse for lab work, urine drug screens, injections, etc. And then finally, they get access to our myriad of groups that we offer outside of the PHP IOP program. So we have an alumni group that meets on Wednesdays at 6 o'clock at the Addiction Center. We also have recovery skills groups, mindfulness groups, relapse prevention groups, etc. So it's a lot of services for folks that need help as they kind of navigate early recovery. So that's the clinical PHP IOP portion of our treatment. We also offer what's called traditional outpatient. So this is where people come to see a therapist, to see one of our psychiatrists as needed, kind of as they continue to maintain their recovery and grow and develop in their lives. And so depending on what their individual needs are, will determine the frequency with which they see providers, and they also have access to these other groups that I mentioned earlier, such as the alumni group. So it's really a great community that we. So in addition to the clinical treatment, we also offer education services. This is where I come in. So I'm the director of education, and our overall mission is to make addiction education, building knowledge, skills, and abilities around how to address addiction effectively in the healthcare setting, to make sure that this is a part of healthcare curriculum across disciplines, whether it's medicine, nursing, social work, psychology, public health, etc. So in order to do this, we have created what are called addiction immersion programs that we host in Atlanta at our Emory Clinic, as well as in Minnesota, California, and Oregon. So these are opportunities for healthcare students to participate in a week-long didactic and experiential program where they're going to learn from our subject matter experts on various topics from psychopharmacology, neurobiology of addiction, screening, brief intervention, and referral to treatment, trauma-informed care, recovery-oriented systems of care. Again, a host of topics that are going to be really influential as they go out into the workforce and hopefully begin to successfully address addiction. And so, in addition to that, they are actually placed in one of our clinics to hopefully get a personal, direct experience with people living with substance use disorders at various lengths of time along that continuum, whether they're one day into treatment or perhaps they've been living in recovery for multiple years. And for a lot of students, this is a novel experience and one that really effectively breaks down barriers, stigma, bias that naturally exists in all of us because of how society has portrayed people with addictions. And we know that stigma is a huge barrier to people getting help. So anything that we can do to help reduce stigma and therefore effectively reduce barriers to care is what we're all about. And so the immersion program is a big part of our education programs. We also have education for professionals through our comprehensive opioid response options, as well as Hazelden Betty Ford's host of education materials, curriculum, continuing education units, continuing medical education units, etc. So there's really a lot of resources available for people. We also do a lot of work in the community, whether it's working with various organizations or nonprofits or recovery community organizations to really try to get the word out there and be a part of our community. You know, here at AAG, we exist in the community. We are part of the community, and we want to give back. We want people to know that there's hope and that there's a place that you can go to get help. So really being a part of the community is a huge part of what we are trying to do. Last but certainly not least, we have our research efforts. We are so fortunate to have a connection with the Hazelden Betty Ford Foundation, as well as being situated within the Emory University healthcare system. So the research that we are able to do spans from testing outcomes of our various programs, whether it's PHP, IOP, our immersion program, and really being able to track longitudinally whether or not these programs are meeting their objectives so that we can then turn around and continue to build those programs to make them even better so that they evolve into something that's really a state-of-the-art opportunity for students and patients to get help. So we also look at, we're currently doing a study in Boston, Massachusetts, looking at screening, brief intervention, and referral to treatment, or SBIRT, utilization in a Planned Parenthood program. So it's actually training staff in a Planned Parenthood setting on how to implement SBIRT with patients and hope that you can increase outcomes, get them connected to care, and hopefully improve quality of life across various domains. Historically, Hazelden Betty Ford has done many research initiatives. They have a Butler Research Institute that's very well known, whom we partner with on other research initiatives. So these are kind of the four pillars: clinical, education, community, and research. And so through these four arms, we try to help people get connected to care. That's really kind of our fundamental goal. Approximately 10% of people with substance use disorders get treatment. This is a very low number, and even fewer adolescents are getting treatment. And so we really want to raise the bar when it comes to allowing people with the disease of addiction to get the help that they need. So we're really excited for this podcast. The idea of the podcast was to ultimately bring on the show subject matter experts from around the world, hopefully, to talk about issues that are currently happening in the field of addiction medicine, in the recovery space, what cutting edge research is going on, what are different approaches that are most effective, whether it's clinical interventions, medications for opioid use disorder. Really, there's no limits to what we could discuss. We'll probably also include personal stories, people who are willing to come on and share about their experience with addiction, treatment, and recovery, in hopes of kind of spreading this message of hope, so that people who are suffering from addiction don't feel so alone. And so we're very excited for the initiation of this podcast. Please stay tuned. I hope to kind of kick off with some really good guests on the show. And stay tuned. We look forward to serving you. And I will put my information on the screen. If there's ever anything I can do, please don't hesitate to reach out. Thank you, and we hope to see you again real soon.